Okay, if you had a full bladder, where would your uterus be? It wouldn't be midline. When your bladder starts to fill, it pushes the uterus out of the way where it normally would be. Okay, any questions on that one? Doesn't look like it. Okay. Oh, you guys, I am not trying to be tricky here. Okay, so remember CPD is cephalopelvic disproportion. That means the baby's head is just not going to fit in the mother's pelvis for whatever reason. Maybe the mom's pelvis is misshapen. So red was popular. The patient who had had a C-section for placenta previa. So just because she had placenta previa with this pregnancy does not mean that she will have it with the next one. So the only one of these answers that for sure you would want to educate the mom, you're going to need a C-section from here on out, is your cephalopelvic disproportion. They're the ones who, if their pelvis doesn't fit a baby, it's not going to fit a baby the next time. All of those other things are kind of hit and miss. Preeclampsia, you may only get that with one pregnancy. Heart D cells, maybe the next baby is going to do great throughout labor and they won't have any distress and they'll do fine. And then a previa too is just kind of like a one-time thing. Just because you had it once doesn't mean you're going to have it all the time with all of your pregnancies. So the right one on that one would be your CPD. Those poor moms, just their pelvis is not shaped well for delivering a baby. Woohoo! You guys did great on this one. Yeah, you're gonna have bruising to the side of the cheeks or the face. The blue that two of you guys put, the top of the head, that's if they use a vacuum. When they put the vacuum on top of the head, then you'll have that circular bruise. But the forceps marks are usually on the side of the face or the cheeks.
Candace, my son had a black eye for forceps.
Yeah, if the baby's not coming out the way it should, straight down, wherever that forceps hits, it can cause bruising. So if the baby's coming down perfectly the way they should, the forceps will be placed on the sides of the cheeks.
It's
but
not.
If that baby is asynclitic at all or turning their head at all, it can be on the eye.
But that's more of a vacuum on the top of the head.
Anywhere on the face.
Oh, this is like.
So yeah, it wouldn't necessarily cause a hematoma.
That's why.
So that's why one is wrong. But it may cause like some bruising or damage to wherever those forceps were placed.
Okay, thanks.
It can actually cause paralysis, like if they do nerve damage, but it's usually not lower extremities. It's like a palsy to the face or arm, and it's usually always temporary.
I've never heard of that.
Okay, yes, this one's to stop contractions. This was on your med sheet, and there's several meds. I will tell you guys on that med sheet, so if you need to go back and review that readiness assignment.
I'm alive, which is good.
Is used to
probably
stop
shouldn't
contractions.
be here, but
My wife had that exact thing.
Sorry. Any questions?
4 years ago.
it is horrible.
Yeah, we were playing tennis and she was like, it just like fell down. I was like, "Are you okay?" And she's like, "No." So we had to take her to the emergency room, and that's what they did.
What'd you get?
They came in and they did the
Emergency surgery.
yeah. The emergency room. There's like a bunch of people, and they did like the scan or whatever, and the doctor was there immediately and said, "You're going to be right now."
Yeah, it's like life or death.
Yeah, cause like I think with my wife they pulled out like I think it was like a pint and a half of blood. Something
Wow. So
Yes,
how far along was
first
she?
100%. So you have a
I don't know that
gestational
it
diabetic
burst.
mom, you're
Oh, it did
expecting a
burst all the way.
larger
Yeah,
baby,
it burst
which
and
what
it was
happens when you have a
That's why
larger
it took her in
baby.
because
That's scary,
she
yeah.
Passed out, yeah.
Yeah, and
Right.
she's all white and stuff. Yeah.
Remember when we talked
She
about
was
they
way
could
farther
get
along
stuck
than I was then.
Yeah.
That's
and have
scary.
shoulder
Still,
dystocia
that's
and
a horrible
complicated
thing, son.
delivery. So
Glad you're here. I'm glad to see you looking good.
I
I'm
know,
glad
I'm
that-
alive.
Good.
Because a week ago today I was not.
Tanner,
I was like,
killing
there's
it.
no way I can move even now. Like I can't move the preschool, so.
Yeah, if you need anything, if there's anything that you're like, so Sam's supposed to come take Trinidad,
I'm nervous he's not going to.
and
He has my Chromebook cart still.
so he took care of these. Where's your Chromebook card?
Like he's still figuring out how to like.
Oh,
Put them in
probably
the
your
car.
notebook cart went out to Coke students.
So hopefully that comes back.
woo, you got this one right too.
they took
So
all
remember
of it.
the second stage
Yeah,
is
he's
basically the
supposed to-
pushing.
Track it down.
The first stage is the time of actual true labor. We know she's in true labor
Yeah.
until they're completely
Yeah,
dilated.
I'll make
Second
sure you
stage
do
is
this.
complete
Shoot
dilation
me an
to
email
delivery
so I
of
can
the
get it from
infant,
the
and
cart.
third
If
is
you
from
have
the
any other
delivery of the
questions, let me know.
infant to
All
the
your stuff's
delivery
in
of
the
the
hallway
placenta.
of the weight room.
Yeah, I
And
was
I'm
trying
gonna-
to find some stuff because I still wanted to do the gifts for the preschoolers.
I'm sorry.
No, it's what it is, you know.
Good luck. We tried to have some kind of order, but at the end it's just like just give it in the box.
Yeah, I talked to Gary and he's like, I will buy you whatever you need
Yeah.
for the graduation. If it's in there, don't even look. He's like, I'll just buy it for you.
Right.
So I think I figured it out.
Good.
But
If you need anything, let me know.
yeah,
We
they're real
try to take
clear.
care of it best we can, huh?
Yeah, I really
Good job.
appreciate it.
This
Because there's
is
no way
difference
I
right
could
there
have
is
done
the
it.
Told you I'd
proteinuria.
get you back.
Thank you,
There
yeah.
are differences in blood
They're
pressures,
real
but the
clear
classic
babies.
is proteinuria. Hypertension can
supposed
go
to
with
start
any of them,
shipping them
including
on this
eclampsia.
Friday.
They're still
Oh, they
hypertensive
are?
with eclampsia.
Yeah.
The difference
So,
between pre
I just told
and
them to
E is
call
they
the
actually are
school.
seizing when they
Yeah,
have
they get them in
eclampsia.
that portable.
Pre-eclampsia, they have not
Yeah.
seized
So I
yet,
don't know where
but they're at
putting
high
it on
risk
because
for
he's even
seizing,
planning
and
on
so they'll
putting-
usually put them on what medication?
So it's that first portable will be the main office.
Maxwell.
I'm gonna be working from home on Monday.
Austin, I could tell that was you.
So like,
I'll put 'em on
when they
the
say it's shipped,
plate.
let me know and I'll contact them and say, hey, when this
I
comes
think
in,
Tanner
you know,
said
let
it
me
too.
know and I'll
Okay.
put it in my office. I put your
I wasn't
laminator
sure.
and
I
everything. It was
can't
like,
Oh, thank
What
you.
was it? You kind of cut out. What?
blurry with dust and stuff.
Dining room
Okay,
plate.
that's awesome.
Okay.
Thanks.
Yeah, anything, just let me know, alright?
Okay, thank you so much, Matt.
Good to see
you too.
What do you think this was? Oh, what is this cage?
Knew this was gonna happen, guys. Okay, so you're the big two that we're deciding between is placental abruption and placenta previa.
There's also one.
Your keyword here is painless. Okay, placenta previa is just when the placenta decides to implant over the cervix at some point over the cervix. It can completely cover it, partially cover it. It does not hurt, but they can bleed as that uterus starts to grow and the placenta kind of stretches. They can bleed, but it is painless. Your placental abruption, that is painful.
Construction
When it
workers are
starts
so
to
crazy.
abrupt, they have sharp pain at the top of the fundus where the placenta adheres. So they'll have sharp fundal pain. That is a medical emergency because remember that placenta is the life. I mean, I've said the cord is the lifeline, and it really is. But the placenta is too. That's where the baby's getting all of its oxygen and nutrients from mom. And so when that placenta abrupts or pulls away, whether it's partial or complete, it is an emergency. You have a complete abruption, you just lost everything from the mom. You have a partial abruption where it starts to pull away, still going to have a lot of pain, some bleeding, but you're still getting oxygen to the baby. But either way, that one's an emergency, the abruption, and it's painful. So where this one says painless bleeding, it's the placenta previa. Is that clear as mud?
Candace, can I ask you a question?
Yes.
So on the slide, it says that a woman who has placenta previa has to deliver with a C-section. But then on the next slide, it says that if it's less than 30%, then you can try vaginal delivery. But if it's more, so like, I was a little confused. So if on the test it would ask, would I say that she must deliver with a C-section?
If they have a placenta previa, yeah. So typically, moms with placenta previa have to have a C-section. But it is right if it's only partially covering the cervix, they may be able to deliver the infant first and then the placenta. But you cannot deliver a baby through a placenta. So typically when they have placenta previa, most commonly it's covering too much of that cervix, and so they do need a C-section.
Okay, thank you.
But there are some women that, yeah, it's kind of just barely covering or partially covering, and then as the uterus grows, the placenta kind of grows up the side of the uterus and leaves that opening, wider open. So I have seen some women with a partial previa that are able to do a vaginal birth, but it's not very common. And I wouldn't trick you, there's not a tricky question like that.
Okay.
Okay.
Thank you.
Oh no, Tanner. Gotta get back up there. This is a tricky one, guys.
We'll see.
What was it, dry rub?
It's gonna be the green one.
Okay, so the majority of you got this one right. A couple put postpartum hemorrhage. Now remember, it can happen after a postpartum hemorrhage, but DIC is something you can get in any type of setting, like in ICU. It's not only with a postpartum mom. So it's basically the excessive clotting, your body's producing excessive clotting factors. They're going to a bleed, and usually in this case, in our class, it is a postpartum bleed, usually within the uterus, and it's uncontrolled bleeding. Everywhere, their IV site, their eyes, just blood will come out everywhere. Not a fun scenario. Someone's on fire. That cat is on fire. I know which one y'all want to put on this one.
But remember, Vanna, I found it in our class.
Yes, Vanna White Googled that.
Wait, get this.
Truck driver.
Woohoo! You guys got it. Why is an occupation as a truck driver cause infertility?
It's the fact that they're sitting all the time and they don't get circulation.
Temperature?
Temperature.
Temperature. There you go. Increased temp. Because you're sitting all day. Good job. Acyclovir is for herpes. They give it for cold sores as well. Group B strep, those of you who put that, what they would give for group B strep is
Antibiotics.
usually your penicillin. Unless they're allergic, they'll do Pen-G. Read this one very carefully.
I don't even know what that is.
Good job.
If, the mother.
Oh, yeah.
So it's if the mom is negative and the baby is positive. So not every mom who is negative blood type has to have a ROGAM. Sometimes that baby's blood will come back and the baby will be negative, and she doesn't need it. She only needs it if the baby is positive.
Candace?
Yes.
So, ROGAMs, so you're just saying as far as like after the delivery and what situation after delivery, because there's other times when ROGAM is given, like during pregnancy or like I had it when I had a miscarriage, I had to have ROGAM.
Mm-hmm. So a miscarriage is counted as after a delivery, but you also get it at 20 weeks.
Right.
So you'll get it at 20 weeks just because we don't know, if you're going to have a miscarriage or what the result's going to be of the delivery. So every mom will get it at 20-ish weeks. And then this question was specifically, all of the answers had to do with after delivery. And the only moms that need it after delivery are those ones whose infants are positive blood type.
Mm-hmm. What if the mom is positive? Would she get it at 20 weeks still?
No.
Okay,
No.
yeah, that makes sense.
ROGAM is only for negative mothers, and they only need that second dose if the baby is positive.
Would they get it just for